we use the term heart attack, it is basically due to blockage of arteries. This is the most common presentation in India and it is rising nowadays. Heart disease has got a multifactorial reasons. So you have got certain modified risk factors, certain genetic and certain acquired. So it's a basically lifestyle disease. Look, there are so many newses in social media, also other platforms, but still we do not have any scientific data to prove that vaccine has something to do with the rise of these vascular events.
What are the most common heart ailments there in India? आपके पास जो cases आते हैं उनमें से सबसे common heart के cases कौन से आते हैं?
देखिए, कॉमन टर्म में इफ यू यूज द टर्म हार्ट अटैक, it is basically due to blockage of arteries. This is the most common presentation in India and it is rising nowadays, especially young Indians less than 40 years of age. We are getting almost 10 to 15% of the cases of heart attack less than 14% in last couple of years, especially in this tertiary care center where we have got most of the semi-urban and urban population.
And this 10 to 15% is an increase जो पहले देखा जाता था.
ये थोड़ा increase अब पिछले कुछ दिनों से ऐसा trend आया है जी.
Why have heart attacks become so common? These days, every other day we see somebody is collapsing. All of a sudden it is happening. Why is it so common?
Nowadays, you see the news of sudden collapse in gymnasium during exercise or some competitive events. These all are healthy young people. These news are very common nowadays. Heart disease has got a multifactorial reasons. So you have got certain modified risk factors, certain genetic and certain acquired. So it's a basically lifestyle disease. Nowadays you see all these, the young people, they are busy in their professionals with a poor lifestyle management, lack of sleep, excessive alcohol, stress, use of tobacco is prevalent. Now, when we see these news of sudden collapse of a young individual, so there are certain risk factors behind that, which we never interrogate or never investigate. Suppose somebody want to join a gymnasium or want to take in a competitive sports, he should check thoroughly before taking participation in these events. You should know your risk factors. Alright. You should not follow a general trend that if somebody is doing a gymnasium for 45 minutes, it is appropriate for you. It may not be appropriate for you.
Body has a different capacity.
Different capacity. You should know your capacity first. You should know your risk factor first and then try to involve in these training programs.
Does it have something to do with COVID vaccine? Because this is the question everybody is asking. So this rise in heart attack cases, has it got something to do with COVID vaccine?
Look, there are so many newses in social media also and other platforms, but still we do not have any scientific data to prove that vaccine has something to do with the rise of these vascular events. There are certain reports here and there, but it's very difficult to establish the cause, that whether really they are due to the COVID vaccine or not. Every vaccine has got substantial side effects, whether it's an influenza vaccine or whatever vaccine we use.
Recently there was a lot of hue and cry about the AstraZeneca side effect.
Yeah, side effects. So every vaccine has got certain side effects. But pertaining to COVID vaccine itself, that rise in the vascular event after it is still, I think, it's a matter of investigation. We don't have any scientific proof for that.